Yeah. Okay. Okay. Good afternoon, everyone. Thank you so much, Angela and her team, for inviting me to to share my latest work. Really, such an honor for me to be here. Today, I would like to share some work I have done on the impact of bedroom privacy, the design of bedrooms, on social network in a long-term care facility in Hong Kong. And I've used a spatial social network analysis approach in this case study. So recently, there is an increasing attention in the bedroom privacy in Hong Kong long-term care facilities. We've recently passed a bill which requires the minimum floor area per resident to be raised from 6.5 square meters to 8.95 to 8 to 9.5 square meters to ensure privacy. However, privacy is still very understudied because there's a limited availability, and also we have a different social and cultural perception of what privacy is in Hong Kong. From my brief research, I could see that there are two major knowledge gaps. The first gap center around the study of bedroom privacy. Previous work has mainly focused on the impact of bedroom design on its impact on clinical outcomes, but we don't know very much about how such a physical design will influence the social life of the elderly residents. Another area is the study of social life in long-term care facilities. Existing work also focus rely on the observation of social interactions and from a more individual-centric perspective. And very few studies have been conducted to visualize the overall whole network picture of social life, and even less from the perspective of space. So in this study, I propose the use of integrated spatial and social network analysis as a way to explore these topics. There are two main objectives in this study. The first one was to identify the residents' location-based social network via this integrated analysis approach. Second was to determine the associations between bedroom privacy and resident social networks. So what does privacy mean in the long-term care facility context? According to Altman, the definition of privacy is a selective control of access to ourselves and to our group. And in this aspect, spatial elements that is the gradation from primary, secondary, and public territory. These are very useful spatial controls for us to manage privacy. And in terms of long-term care facilities, primary territory refers to the bedroom, and that is concerned with factors such as bedroom occupancy rate and space that's directly adjacent to resident bedroom. And in the secondary territory, we're looking at intermediate spaces such as corridor, things that link the primary and transition into the public territory. And finally, the public territory is, for example, the common area, and we are very concerned about factors such as visibility between the bedroom and common area, and also having the visual privacy from being seen, or when we can decide when to be seen from the common and public area. So currently, the social life of the residents, it's widely known that social life benefits the well-being of elderly residents. In Hong Kong, a resident on average has about 0.6 to 2.6 network partners in long-term care facilities. Residents with Alzheimer's, we have seen they also have less network partners than those without Alzheimer's. Studies also show that the physical environment is very closely associated with the social life in long-term care homes. But we still need to know more about how, if and how the physical environment actually affects social life and social network. Having different types of social relationships, such as peers, family, and staff, is very important in a long-term care home. In general, older adults have 4 social clusters, and they are diverse, family-focused, friend-focused, and restricted. However, most of the studies right now, they study the social clusters mainly focuses on healthy older people living in a community, and relatively little is known about the network types among residents in long-term care facilities. So how can we measure social life? And there are more and more studies using social network analysis, SNA. And the benefit of SNA is that it can identify if residents are at risk of isolation. It can also serve as an indicator of psychological and cognitive outcomes in dementia care. And most importantly, it can advance service providers' understanding of resident social life. But however, the physical space cannot really be ignored, especially for people living in a long-term care facility. They spend most of their day sitting and living in the compact and confined physical environment. In the urban study developed as field, there are more studies now using integrated approach. So it's a spatial and social network analysis to understand social integration. For example, the diagram below, this research used GPS mapping to understand the places people hang out between the local and migrant people in a mainland Chinese city to see how integrated they are. And I think the same principles can be applied to help designers understand how interior design of long-term care facilities can influence or influences social networks. So we took a 3-stage approach. The first is we used the indoor positioning system, IPS, to first identify the key locations we wanted to study. For example, bedrooms, common areas, and dining areas. And second, we have the participant to wear smart watches so we can find out who is at what location and at what time. So using this information, we can construct a user to location social network. And then looking closer at each location, we can also see that which users are at that same location at the same time. Then that will help us to develop a user-to-user social network. This was the study site. Study site was a traditional facility for 200 residents, over 5 stories. And the layout was a H-type layout with a pantry and nursing station in the middle. Each floor had an area around 4,000 square feet with 4 types of bedrooms, ranging from 3-bedroom, 4-bedroom facing the corridor, as you can see in the dark orange area, and 4-bedroom facing the common area, and a 5-bedroom type. In total, we recruited 48 residents based on the stratified sampling. We also developed privacy assessment tool using the 5 architectural factors that we had identified, and also developed a geometrical indicator to evaluate privacy in shared bedrooms. Data was collected on indoor positioning system. We had signal receivers installed on the walls of each key location. And the residents, the participants wore smartwatches, and as they moved around the space, their location was registered by the receiver, then transmitted to the cloud server. And so we did this tracking for 31 days, and we collected 140 million records, which were then aggregated into 18,000 hourly records. So we had a 24-hour pattern. So after we collected the raw location data, they were then processed, filtered, and categorized into a spreadsheet of user to location data. And based on this data, I then conducted 3 types of analysis. The first one is I visualized the social network using the software UCINet. And following that, K-means cluster analysis was conducted to identify what type of social network clusters existed in this long-term care facility. And lastly, I also conducted multiple regression analysis to find out the association between privacy and social network characteristics. So the first set of results showed that we could see the space use patterns. And we can see that one of the most used rooms in this care home was their own bedroom. Residents returned to their own room several times throughout the day. And the second most used spaces were the common areas, living room 1 and 2, and as well as some in the pantry. Interestingly, apart from their own room, they also very often went to people who lived in 4 bedrooms. So 4 bedroom facing the corridor and common area. And on the periphery, we can see that 5-bed, 3-bed, and lobby were less used. So with the UCINet, we could see the social network, and we can see that most of the residents belong to a cluster. And we can see from the table that on average, the resident had about 2 network partners. Particularly in 4-bedroom facing a common area and a 5-bedroom typology, these residents had a higher number of network partners. But however, having 2.43 and 2.79. But however, if we look across to the degree centrality, they had the least and relatively lower degree centrality, which means they have weaker social ties. So people living in a common area, opposite the common area, although they met a lot of people, but they didn't frequently interact with one another. And the 4-bedroom facing corridor type had a relatively higher number of network partners, 1.85. They had a higher number of frequency of interaction, and they were the strongest. They were in highest degree centrality, which means they were very important in holding the whole network together. The cluster analysis results show that we identify 5 social clusters in this long-term care facility. About 10% of the participants belong to a diverse network cluster in the common area, and about 21% of the participants belong to the diverse cluster in a bedroom area, and 23% were focused on non-roommates in a common area, and 29% were found to interact mainly with their roommates inside the bedroom. And lastly, about 17% of the participants had a restricted lifestyle. They mainly stayed in the bedroom and did not interact with either roommate or non-roommates. We then look further into the network partner types according to bedrooms. So here we can see 3-bedroom resident from 3 bedrooms. About 57% of them they were in a restricted cluster. People lived in 4-bedroom facing the corridor. They had a distinct cluster with the non-roommates. And people who lived in a 4-bedroom facing the common area, a high percentage of them had a diverse social network, but not in a common area, in other people's bedrooms. And finally, people who lived in the 5 bedrooms, half of them had a were in the roommate-focused cluster. And then when we look at the associations between architectural factors and social network characteristics, we can see that overall, privacy had a moderately significant association with the social network characteristics. For example, we can see in the bedroom occupancy, the higher number of people you have in each bedroom, And you can see with the 2 stars, it was significantly correlated with less established network in the bedroom with the roommates. So that suggests that higher the number of people, less likely they become close acquaintances. And also, interestingly, in the visibility category, we could see that it was a positive, significant positive correlation. The higher the visibility to the outside the bedroom, to the common area and other people's rooms, there was a higher percentage of people becoming social network partners with non-roommates in the bedroom and also in a common area. So the summary of the results are that residents have about 2 social network partners in this long-term care facility. About 70% of them could be at the risk of isolation. We also saw that these older adults have similar social network clusters as those who live in a community. They have the same needs. Bedroom types appear to have an influence on the social network clusters. And finally, architectural design factors of privacy have a significant impact on social network structure. So how can we design resident bedrooms to enhance social networks? In terms of bedroom occupancy, it should be lower whenever possible. However, as we could see in this study, people who live in the 3 bedrooms, they were actually the most isolated. So although they had enough privacy, designers should also and service providers should also think about wall openings through which the resident can still somehow see or communicate with their neighbors and staff. Visual privacy. If space is not possible, we should always provide movable and adjustable installations, such as movable screens, so that resident can decide when and where they want to be seen. And we also saw from this study that residents, they might prefer to interact in other people's bedrooms, so in spaces that's away from the supervision of the staff. In terms of visibility, residents should be provided with clear visibility to the common areas so they can decide how and when they want to socialize with others. And residents should also be able to see nursing station from their bedrooms in case they have concerns of their own safety. In terms of the adjacency of bedroom, it was interesting to see that the residents preferred to interact with people in areas close to their own bedrooms. And this aligns very well with existing literature that smaller social spaces near the bedroom also has often become the social hub or preferred space by residents. And from this study, we can also see that among the 4 different types of bedrooms, a small group of bedrooms are beneficial. For example, residents of the 4 bedrooms facing a short corridor, they had a stronger and a more diverse social network. And lastly, traditional spaces should be provided to enable a range of privacy settings where residents can choose to use. Diverse spaces such from nooks, niches to small-scale seating can encourage different types of social activities. So the study had several strengths. The first one is that I think these results provided substantial evidence to support the recent bill to increase the minimum floor area, so we can enhance residents' dignity and privacy. And the study also supports the evaluation of future facilities in a privacy category. It can benefit the communications between nursing experts and designers. And I think it also provides useful insights for compact long-term care facilities in other high-density world cities. But there are also several weaknesses. For example, first, we did not include the other environmental factors that might affect privacy, such as acoustic control. We also did not include individual factors, such as socioeconomic status and health conditions. Also, about in terms of indoor positioning system, it had an accuracy around 80%. So which we may have missed some interactions and misrepresented the network. And finally, that the data sample 48 participants were too small to generalize the influence of bedroom privacy on social network. So future studies could focus on quantifying factors according to a reliable standard, so making the results comparable, and include the perspectives of staff and residents on the design preferences and social network patterns, and also include more participants from more long-term care facilities. And finally, to examine different design layouts, bedroom layouts in multiple locations to enrich the design factors. So that is my presentation. Thank you very much.